So without further ado, I will pass the floor to Suerie Moon. As I said, Suerie Moon is Director of Research at the Global Health Center at the Graduate Institute of International and Development Studies in Geneva. Suerie was a former Director of Research and co-chair of the Forum on Global Governance for Health at the Harvard Global Health Institute. She was also an adjunct professor of global health at the Department of Global Population and Health at the Harvard School of Public Health. Surie's work focuses on global governance and the political economy of global health. Suerie, thank you very much for joining us, and please, the floor is yours. Welcome.
Thank you so much for the invitation. I'm just going to take a moment to put some slides up. Good morning, good afternoon, good evening. Buenos días, muchas gracias por la invitación. I'm going to continue speaking in English because my Spanish is very bad. So I thank very much the interpreter, Luis, and I hope we can engage in some bilingual Q&A together soon. I wanted to just put a few thoughts on the table to get the conversation going. And of course, this webinar is focusing on the global governance of COVID-19. And I think the first question we have to ask ourselves is, have we seen global governance? And just to offer a few observations, one thing that we have seen, I think, is a emergence of a kind of dog-eat-dog nationalism. And we've seen that most clearly in the scramble for diagnostics and masks and other equipment that has been in short supply, with a number of countries, of course, left without adequate access to supplies. We've also seen, I think, a very strong return of the state, or return of the strong state, with both positive and negative implications for public health and the right to health. We've seen, of course, the state is central in enforcing lockdowns, in passing economic rescue packages. The state has made massive investments in, states, I should say, made massive investments in research and development. But at the same time, we've also seen a rise of authoritarianism and limits on democratic rule, as well as on democratic dissent. We have seen many attacks on the World Health Organization and more broadly on multilateralism, the multilateralism that WHO represents. So against this backdrop, I think it has been tempting, and many commentators have framed the issues as being about a US-China rivalry, and I think there's, of course, truth to that. I sit here in Geneva, Switzerland, and perhaps that's one of the reasons why I see an important third player that has already emerged, and that is Europe. I think Europe has played a key role not only mediating this rivalry, but in fact has emerged as a global leader. One of the most important examples of that is the World Health Assembly COVID-19 resolution. I think the WHA that just finished a couple of weeks ago was one of the most important in a generation. And if the Assembly had failed to agree on any kind of consensus resolution, it would have been a real blow to global governance, a real blow to efforts to strengthen international cooperation. And for this reason, it was really critical that the European Union played a leadership role. And this was, in fact, the first time that it had put forward a resolution and played the central role that it did as a regional body rather than as individual member states. And what did this resolution contain? I think this was quite telling. First, there was a strong emphasis on ensuring equitable access to medicines, and some of the language around intellectual property rights created some discomfort for the United States, which disassociated itself from that language. It included language calling for an inquiry into the origins of the virus, and this is text that would have been sensitive for China. It called for a review of WHO when appropriate. This was something that the US had been calling for, but many countries were not that comfortable with it because they saw this as part of the broader attack on the organization and multilateralism. And so when we see that Europe was able to, in fact, craft a consensus across these different camps and to broker agreement, I think we see that this was really an important moment where we saw this region, this regional organization, and what we might call in international relations, the middle powers, so not necessarily the superpowers, but the middle powers in the world, really reinforcing a global approach to governance. And I think this is a really important novel dynamic that has emerged just over the last last several months. But if we take a look at what is happening now, I think primarily what we see is a system in flux. It's not really clear, in fact, if we will have effective, coherent global governance or not. And I think that looking at the COVID-19 medicine situation provides one of the most useful lenses through which to understand where we with global governance. And one of the reasons for that is medicines and health technologies more broadly is an area where you absolutely need international cooperation. Many of the measures being put in place now to get this pandemic under control are actually, primarily the responsibility and the power rests at national level. But medicines is a really important exception to that rule, where we really need to bring the international community together. And so the question is, how well are we doing? Many of you will have seen in the newspaper a lot of discussion about a ongoing vaccine race. And I think there are two lenses through which we can see this race. The first is through a public health or a right to health lens, and that would consider a vaccine as a global public good. We've seen this language being endorsed now by the president of China, of France, the head of the European Union, Germany, a number of other heads of state. And essentially the key idea here is that it should be accessible to all. And of course, this is a very logical position, because we're not going to get the pandemic under control until you can get key technologies available to all countries. But we also see a very important second lens through which this race is playing. And that's what I would call a geopolitical lens. And through this lens, a vaccine is seen as a asset or a source of diplomatic power. And of course, this leads to a more competitive dynamic rather than a cooperative dynamic. And one way of summarizing this lens would be me first, or me and maybe my friends first, where countries that have control over research and development and production of vaccines not only have a stronger and advantageous position in the global political economy, but can also use that resource as a bargaining chip to influence other countries. And so what we see is a real tension, I think, between these two lenses, or these two strands of efforts, is can we make a vaccine available as a global public good, or will it remain a strategic asset? And so we see a system in which governance is in flux. There's rapid change happening, but it remains very unclear where's the system going, and there is quite a lot of competition and tension, as Professor Andia was mentioning in her opening remarks. What are some bits of evidence regarding what's happening? One is that we've had just in the last few weeks a number of initiatives being introduced. The Access to COVID-19 Technologies Accelerator, 10 different organizations that backed this, with responsibility for diagnostics, vaccines, and drugs being divided up among these three different global health initiatives: the Global Fund, Gavi, and UNITAID. We've seen the launch of the WHO Technology Access Pool alongside the ACT Accelerator, and it's unclear how the two will work together, if in fact they will work together. We've seen national efforts. The US and China are the two countries that seem to have the greatest control over research and development and production of vaccines right now, and it remains unclear to what extent will there be cooperative efforts backed by those countries. Very different approaches in terms of the political speeches, but we have yet to see concrete arrangements, I would say. And then we have a regional approach, where Europe recently announced an initiative where they also want to make sure they can secure enough access to vaccines for their own population, following in the footsteps of the US in this regard. And so there are a lot of open questions as to whether this emerging system is one that will be coherent and effective, in fact, in getting access to technologies for everybody, or whether it will remain what appears to be I would say at least an unclear system right now. So this webinar is supposed to be looking at the future, and I don't want to go out on a limb yet and make any strong predictions for the future, but I would like to put a number of questions on the table. And I think the future of global governance is really in flux right now. Some of the key questions that I think are worth asking is, one, can these global health initiatives in fact serve all countries? We know that historically initiatives such as the Global Fund, Gavi, et cetera, have not focused on the middle income countries. They focused on low income and lower middle income countries. Especially in recent years, that has been a trend in development assistance. But of course, most of Latin America is comprised of middle-income countries. High-income countries also need access to health technologies and are not necessarily feeling secure that they will be able to get access. Can these organizations, in fact, pivot very rapidly to a very different set of demands? If they cannot, or if one doesn't have confidence that this is what these organizations will be able to do, what are other arrangements that might make sense? What is going to be the role of UNICEF, PAHO, and other regional organizations? Will they be working side by side with the global organizations? Will they be complementary or competitive? What is the role of implementing patent flexibilities such as compulsory licensing, technology pooling, or technology transfer, in particular, because there is, of course, strong interest in strengthening local production, necessarily having to rely on other countries for the supply of really essential products such as drugs and vaccines. Nevertheless, even if we do have increased local production of technologies, a key question remains, will that come hand in hand with a commitment to regional supply? Because it doesn't help if one country says, yes, we will manufacture these products, but we're going to keep those products primarily for our own people or for our own people first. And I think these are all questions that remain largely unsettled right now. Last but not least, my last point is really about civil society participation and public accountability, which I think is one of the key questions raised by this webinar. And if we think about Global Health Governance 1.0, there was a certain model of governance that emerged over the last 20 years, I would say. And this can be encapsulated in the multi-stakeholder approach, where the boards of big organizations, such as Gavi Global Fund, UNITAID, and many, many others, included multiple stakeholders, governments from north and south, foundations, civil society, private sector, experts, etc. One of the questions that has already come up is this 1.0 model, in fact, going to be effective during and after the COVID-19 outbreak? And just a couple of days ago, civil society representatives, in fact, to the boards issued for the first time a letter jointly. And the letter is basically saying, not exactly in this word, using this word, but essentially this letter says that civil society representatives don't feel they have been adequately included in the governance of these initiatives so far. This really leads to a question of what might global health governance 2.0 look like. And I think there's a need for a much longer discussion about this. But the key idea I'd like to leave you with is that rather than only having formalized seats at the table, which is really the 1.0 model, I think that an embrace of transparency, an embrace of radical transparency is going to be really important because this will enable action and accountability by all stakeholders, whether governments or journalists or civil society, foundations, private sector, etc. And I think right now the stakes are so high, the geopolitical interests are so powerful that regular modes of governance through boards is not going to be effective in holding all stakeholders accountable. I think the interests are not only regarding restoring health, but also we have very, very powerful economic and security interests at stake, and of course the broader global public interest in getting this epidemic under control. And I think nothing short of a much more radical embrace of transparency and thinking differently about global health governance is going to get us anywhere close to any kind of accountability for the response. So thank you very much. Muchas gracias. I look forward to the discussion.
Thank you very much, Suerie. This is a wonderful presentation, a very thought-provoking. This is exactly what we're looking for.